Awesome, Mr. President.
Thank you, Mr. Chairman, committee members. I'm new to this, so you'll have to excuse me if I stutter a little bit. I came today because I'm very passionate about this. I am a registered diagnostic medical stenographer. I perform ultrasounds professionally to support my family at the biggest ER in Ohio, actually, here in Columbus. I also have side jobs where I'm registered OBGYN and routinely scan embryos, fetuses, babies, whatever you call them, it's all the same thing. From the moment that we can see them at 2 millimeters, I can detect a heartbeat. That's 26 days after conception. I get a heartbeat on this baby, separate from the patient, separate from the mother. When we talk about viability, as I've heard today, my definition, when I say viable, I am speaking of when we're talking within radiology. In a radiology report or in a physician's report from the ED, whenever the term viable is used, it pertains to the embryo or fetus having a heartbeat and therefore termed viable and living. So I'm not talking about viability as living outside of the womb and being able to live outside the environment. When in radiology in a professional setting and reports, we talk about viability as being alive, as having a heartbeat. We say the pregnancy or the fetus is viable. This heart rate, which can be attained by either a handheld Doppler device, or in my instance, I use M-mode via ultrasound. Like I said, we are not evaluating the mother's heart rate. We get that in triage. That is a totally separate heart rate. That is a separate patient. Once we can discern viability of the fetus, we now take care of the patient as actually 2 patients. It's called maternal fetal medicine, mother and fetus, mother and baby. Women also come in to be treated for many different reasons concerning pregnancy. In my field, coming into the ER, examples include bleeding while pregnant or to evaluate pelvic pain, or they come in to confirm the baby is growing in the uterus and in an ectopic location such as in a fallopian tube. In all cases, an ultrasound is again ordered to confirm viability at the minimum. As a professional ultrasonographer, obtaining this information is actually quite easy. By using a transvaginal approach, an embryo can be detected when he or she is 2 millimeters in length. This corresponds to a conceptional age of 3 weeks, 5 days, or in other words, 26 days after conception. We have the technology of not only detecting the embryo at this early stage, but as soon as we see him or her, we can also detect a heart rate in these tiny human embryos. 26 days. I can see a heartbeat on a newly formed separate person at 26 days after conception. This is not my own personal opinion, but rather known as medical fact of any basic OB ultrasound 101 conferred by any respected medical test. It also serves to mention a detail of being an ultrasonographer who scans many pregnant women. Another aspect of my job not readily exposed or heard in public. Other women come in because of complications following an elective abortion. These women might be experiencing extensive pelvic pain or cramping or heavy vaginal bleeding. At times, the bleeding is mixed with very large amounts. When a patient represents with these symptoms, an ultrasound is again ordered, and they come to me. When a patient presents with these symptoms, my job is to then rule out RPOC, which stands for rule out routine products of conception in medical terms. I may go a little further to explain what this means. It means evaluating the uterus for blood products, placenta tissue, or baby parts left inside after a recently terminated pregnancy. I have personally witnessed this on many occasions. I have seen such detail with high resolution frequency that I have seen a free-floating hand, all 5 fingers intact, of an 11-week baby left behind in the mother's uterus. As a medical professional, as a concerned citizen, and as a worried mother for our community and our children, and as a person who has witnessed firsthand the brutality of abortion, I urge you to protect life before birth. I urge you, actually plead with you, to consider defending those who are small, who cannot ask you themselves to please defend their lives. So the next time you hear someone say pro-choice, ask yourself, choice of what? The answer is the choice between life and death. I plead with you to please choose life. Thank you.